Hi, are you excited for Excitalopram? Are you ready to go with Lexapro? My name's Brianne Saldivar and I will be starting this commercial over Lexapro and Excitalopram. Hi. Okay, now before we get into what Lexapro is, let's see what it is used for. Lexapro is used for anxiety and depression, which it is FDA Food Drug Administrated approved, and it is known to be utilized for off-label mental health disorders such as for migraines, panic disorder, OCD, obsessive compulsive disorder, PTSD, which is post-traumatic stress disorder, and social anxiety disorder. So all of these mental health disorders that I listed are considered off-label for Lexapro and escitalopram. So, escitalopram is the generic name for Lexapro. So they're interchangeable. Lexapro is the brand name. As mentioned before, the FDA has approved escitalopram for treating major depressive disorder and generalized anxiety disorder. And with the population, approximately 19.1% of adults in the USA have an anxiety disorder, that's over 40 million adults. So, as I mentioned before, Lexapro is utilized and FDA approved for depression/major depressive disorder and generalized anxiety disorder. So those are the two mental illnesses that I will be going over, the symptoms that Lexapro is going to help. For depression, you can feel symptoms of feelings of worthlessness, hopelessness, helpless, and guilty. You could experience depressive moods such as feeling very sad, very empty, numb, tearful. They have trouble concentrating, very lethargic, tired. You could have suicidal thoughts or behaviors towards yourself. People may experience a loss of interest or pleasure in usual activities that they usually have fun in. And sleeping/eating more or less than normal. So sleeping more, eating more, or less than normal, which usually it's less. The symptoms of generalized anxiety disorder consist of fatigue, which is low energy and often very tired. They could be irritable. There's restlessness, trouble concentrating, muscle tension, and disturbances with sleep, usually which is trouble falling asleep or staying asleep. Now going over escitalopram, Lexapro. So the generic names, as I mentioned before, are escitalopram or escitalopram oxalate. The medication class, it is known as an antidepressant/an SSRI, which is a selective serotonin reuptake inhibitor. It is also known and much used for a first-line medication treatment for anxiety and depression. The administration, the way you take the medication, can be oral, which is through a liquid or a tablet. The availability of this medication is only through prescription. And how it works, what SSRIs do, is it works by increasing the amount of serotonin in the brain. So why choose escitalopram Lexapro? There are many benefits to this SSRI antidepressant. So unlike tricyclic antidepressants, TCAs, the benefits to Lexapro is that it has way fewer antihyaluronic or antihistaminic side effects, a lot less side effects than TCAs, which is why it is known to be the first line of medication. So, also, another benefit is no problems are known to be associated with long-term use of this medication. So long-term use, As of right now, there's no negative effects. And it helps alleviate the symptoms and recovery from depression and or anxiety, since depression and anxiety can be comorbid. Important notes to take before taking Lexapro is to consult with your doctor and ensure that it is suitable for you, especially if you are on any other medication, because taking both at the same time could reduce the benefits and or make things worse. And also, do not take Lexapro unless it has been described to you from a healthcare professional. So don't take any medication that is not prescribed to you. As with most medications, there are side effects to Lexapro. The most common side effects that people record to happen are they have trouble sleeping, they can feel nauseous, lots of sweating, feel tired, and there's sexual dysfunction or low libido. The rare or more severe side effects that could occur while on Lexapro or escitalopram are you could have an allergic reaction, a severe allergic reaction. You could experience suicidal thoughts or actions. You could get serotonin syndrome. There's angle-closure glaucoma and seizures that can occur. Another benefit to escitalopram, Lexapro, is that it is FDA approved for both children and adults. So not only is it FDA approved for depression and anxiety, but also in children and adults. The age range for taking this medication is 12 and up. The recommended dosages consist between 10 to 20 milligrams. The effectiveness and success of escitalopram/Lexapro can be demonstrated by, in a meta-analysis of 12 antidepressants, escitalopram was recorded to be the most accepted and effective antidepressant out of the 12 that demonstrated the most stable efficacy in this study. So, as well as in Zhang and colleagues' study, 60.4% of the patients found escitalopram to be successful in treating their anxiety symptoms. There are cultural and religious concerns with Lexapro. In a cultural perspective, anxiety disorders are subject to a variety of cultural influences and the cultural language of expression of the client. So, depending on the client's culture, there could be potential concerns with taking medication for anxiety. Cultures all have their own set way in how emotions are revealed. For some cultures, can be more open and accepting to expressing intense emotions, such as anxiety, and other cultures could view anxiety as a holistic experience rather than symptoms. There could also be cultures who don't like to express their feelings. Religious concerns consist of one's religion can have an impact on not only of the use of medication that is accepted throughout the religion's views, but also if the religion even acknowledges mental health illnesses' existence at all. For instance, Ingersoll and Rock from the text explained that in 1989, the Church of Scientology went against Prozac and the use of antidepressants because they believed that by taking this medication would trigger aggression or sociopathy.